Question 1. Which of the following elevated serum values is consistent with a diagnosis of hepatitis B, HBV? A. ALT. Alanine aminotransferase, ALT, is an NBSB enzyme and NBSB, found mostly in the cells of the liver and kidney. And NBSB, normally, ALT levels in blood are low, but when the liver is damaged, ALT is released into the blood and the level increases. Normal levels are 29 to 33 IUL for males and 19 to 25 IUL for females. Albumin levels and WBCs are lower in the presence of liver disease. Burn is related to kidney function. Question 2. The healthcare provider is assessing the glucose level of a patient with a diagnosis of diabetes. Which of these is most helpful in evaluating this patient's long-term glucose management? A. Hemoglobin A1C. The A1C blood test gives information about the average level of glucose for the previous 3 months. It is the most accurate method of tracking a patient's compliance. The A1C test is based on the attachment of glucose to hemoglobin, the protein in red blood cells that carries oxygen. In the body, red blood cells are constantly forming and dying, but they typically live for about 3 months. A1C test results are reported as a percentage. An A1C level below 5.7% is normal. A range of 5.8% to 6.4% is pre-diabetic. Type 2 diabetes is diagnosed with a level of 6.5% or higher. The A1C test is sometimes called the hemoglobin A1C test, HbA1c test, or glycohemoglobin test. Question 3. A patient is prescribed a new medication for the treatment of hypertension. While supine, the patient's blood pressure is 112/70 mmHg and the heart rate is 80/min. The healthcare provider assesses the patient when the patient changes to a sitting position. Which of the following indicates the patient is experiencing orthostatic hypertension? A. BP 88/60, HR 100. Orthostatic, or postural, hypertension is defined as a decrease of more than 20 mm of mercury systolic or more than 10 mm of mercury diastolic and a 10 to 20% increase in heart rate. It results when the patient's blood pressure is not maintained during position changes, i.e., from lying to either sitting or standing. Question 4. A patient with a history of atrial fibrillation for 3 days is admitted to the cardiac unit. Besides initiating an antidysrhythmia medication, which order should the nurse anticipate? B. Prepare a heparin infusion. Heparin reduces the risk of stroke that results from blood pooling and clotting in the atria. Medication will control rate and rhythm, so atropine is not indicated. Both cardioversion and ablation are treatments when medication has not been effective. Question 5. While reviewing the results of a client's urinalysis, UA, which of the following is not included in the report? A. Identity of bacteria. There should be no bacteria in a normal urinalysis. If bacteria are present, the sample is sent for culture and sensitivity. A few drops of urine are put onto a petri dish and stored at body temperature for a few days. If there is any bacteria or yeast, they will grow and multiply. Lab professionals then identify the pathogen and determine which antibiotics are best for treating the infection. The other options are part of a standard urinalysis, UA. Question 6. Which lab value alteration is likely a result of corticosteroid treatment in a type 1 diabetic patient diagnosed with pneumonitis? A. Glucose 200 mg per deciliter, 11.1 millimoles per liter. Type 1 diabetes is characterized by hyperglycemia secondary to the body's inability to create insulin. Corticosteroids cause a rise in blood sugar, even in a non-diabetic patient, by increasing insulin resistance and triggering the liver to release additional glucose. Changes in sodium, albumin, and potassium would not be expected findings in this scenario. Question 7. During an assessment of a patient experiencing acute hemorrhage, the healthcare provider would most likely expect to find B. Tachycardia. The heart rate will increase in an attempt to deliver more oxygen to the brain and body. Tachycardia is considered a pulse rate greater than 100 bpm. Question 8. A client with a known diagnosis of type 1 diabetes presents to the emergency department with a blood glucose level of 538 mg per deciliter. The nurse knows that the client is at the greatest risk for which acid-base imbalance? B. Metabolic acidosis. The client is at the greatest risk of developing metabolic acidosis. Diabetic ketoacidosis is defined as an increase in the serum concentration of ketones greater than 5 meql, a blood sugar level greater than 250 mg per deciliter, although it is usually much higher, and a blood, usually arterial, pH less than 7.3. Because of insufficient insulin, glucose continues to circulate while the body uses fat and glycogen for energy. Byproducts of fat metabolism, ketones, are acidic, leading to metabolic acidosis. Question 9. The healthcare provider is preparing a patient in the medical surgical unit for a thoracentesis. Which of the following is the most appropriate position for the patient during the procedure? B. Sitting up, leaning over a bedside table, and feet supported on the ground or a stool. A thoracentesis is performed to remove fluid or air from around the lungs, perform a biopsy, or administer medication into the pleural space. The patient should be sitting up and leaning over a bedside table with arms resting on the table and feet supported on the ground or a stool so the needle can be inserted appropriately. The point of entry is from the back of the patient. Question 10. A patient who takes daily low-dose aspirin experiences prolonged bleeding from a superficial cut. Which of the following lab results would be expected for this patient? B. Bleeding time of 8 minutes. During primary hemostasis, a platelet plug is formed. Clotting factors are involved in secondary hemostasis, coagulation. Both APTT and PT measure the coagulation pathways. Aspirin inhibits cyclooxygenase, COX, which promotes the synthesis of TXA2. Because TXA2 is necessary for platelet aggregation, primary hemostasis is inhibited. This is measured by bleeding time. Platelet activity is affected but not the number of platelets. Question 11. A pregnant client was scheduled for an amniocentesis to evaluate the amniotic fluid for a lecithin-sphingomyelin (LS) ratio. The results show a ratio of 1:1. This is indicative of A. Lung immaturity. In the third trimester, the fetus lung surfactants pass into the amniotic fluid. In a normal pregnancy, the amount of lecithin in the amniotic fluid continues rising but the amount of sphingomyelin stays about the same. The more lecithin compared with the amount of sphingomyelin, the more likely the lungs are mature. A ratio of 1.5 to 1 indicates immature lungs. A ratio of 1.5 to 1 to 1.9 to 1 indicates a risk of respiratory problems. A ratio of 2.0 to 1 or greater indicates mature lungs. The other options are incorrect. Question 12. For a stroke patient, what is the best position for insertion of a nasogastric (NG) tube? A. High Fowler's. High Fowler's position is the best position to avoid aspiration. Have an emesis basin and suction equipment nearby because tube insertion can cause temporary nausea. Question 13. A patient with a fractured hip has been placed in Buck's traction. Which of the following statements about this treatment is true? B. The purpose is to immobilize the legs. Buck's traction is one of the most common orthopedic mechanisms for temporary immobilization of a hip or femur until surgery can be performed. It exerts traction on one or both legs by using a system of ropes, weights, and pulleys. A Steinmann pin goes through large bones and is used to stabilize large bones such as the femur. Kushner wires are used to stabilize small bones such as fingers and toes. Buck's traction is not intended for healing. Question 14. A patient has just been admitted to the hospital for observation. The laboratory results are hematocrit 45%, hemoglobin 15 gdl, 150 gl, platelets 50 times 10 to the power of 9 divided by L. Based on these results, which of the following is the patient's primary problem? A. Recurrent nosebleeds. Platelets, thrombocytes, are important for blood clotting. The normal range for platelets is 150,000 to 400,000 mcl, 150 to 400 times 10^9 L. Platelets are decreased in this patient. This will lead to impaired hemostasis, which could explain the patient's recurrent nosebleeds. Question 15. A patient with a diagnosis of Wolff-Parkinson-White syndrome is undergoing a catheter ablation procedure. For the healthcare provider caring for the patient after the procedure, which is the priority intervention? B. Monitor insertion site and distal pulses. Because the catheter may cause trauma to the vessels, the healthcare provider will monitor for hematoma formation and interference of circulation distal to the insertion site. Bleeding at the site is the most common complication. Assessing level of consciousness is a routine post-op order, so it is not a priority. The extremity where the catheter was inserted will be immobilized initially, so the patient will not be allowed out of bed to use the bathroom. The patient will be on a cardiac monitor, so auscultation of the apical pulse for 1 minute is not a priority. Question 16. The nurse is assisting a doctor with the removal of a central venous catheter. To prevent complications, the patient should be instructed to B. Perform the Valsalva maneuver as the catheter is pulled. The Valsalva maneuver is performed by attempting to forcibly exhale while keeping the mouth and nose closed, as if trying to have a bowel movement. During removal of a central venous line, this maneuver prevents air from entering the line. Question 17. While doing admit for a male client, the nurse asks about possible allergies. The client denies any drug allergies but states he is allergic to bananas and avocados. The nurse knows these allergies put the client at risk for an allergy to A. Latex. The proteins in bananas, avocados, apples, carrots, melon, and tomatoes are similar to those in latex, so persons who are allergic to any of those foods should also avoid latex products. Clients with a history of using latex products, such as healthcare workers, may also have developed a sensitivity. Allergic reactions to latex include rash, itching, reddened skin, asthma-like symptoms, or even anaphylaxis. Question 18. A construction worker is brought to the emergency department after falling headfirst through a plate glass window. The client's eyes are bleeding and swollen completely shut. How should the nurse record the eye component of the Glasgow Coma Scale, GCS? C. Eyes closed by other factor. If some local physical factor precludes the patient being able to make a response, that component of the scale is not testable, NT. Do not assign a score of 1, no opening of eyes, because there is an interfering factor that prevents observation or assessment. Question 19. The nurse is reviewing the arterial blood gas, ABG, results from a client with a diagnosis of chronic obstructive pulmonary disease, COPD. Which of the following acid-base imbalances can the nurse expect to find? B. Respiratory acidosis. In COPD, air is trapped in the alveoli, causing CO2 retention. Respiratory acidosis is a condition that occurs when the lungs cannot remove all of the carbon dioxide the body produces. This causes body fluids, especially the blood, to become too acidic. Other causes of respiratory acidosis include severe obesity, obstructive sleep apnea, scoliosis, lung tissue diseases such as pulmonary fibrosis, and medications that depress breathing such as opioids. Question 20. The results of an adult patient's blood pressure screening on 3 occasions were 1 20/80 mmHg, 1 30/76 mmHg, and 1 18/86 mmHg. How will the healthcare provider interpret this information? A. Hypertension stage 1. A patient is considered to have hypertension if even one of the parameters, either diastolic or systolic, is elevated. This patient has prehypertension, defined as 120 to 139 mm of mercury systolic or 80 to 89 mm of mercury diastolic. Question 21. The healthcare provider is assessing a patient recovering from a total knee replacement. Which of these assessment findings indicates the patient is at risk of developing a complication from the surgery? A. Pale toenail beds. Pale nail beds of the toes indicate neurovascular damage. Other signs of neurovascular dysfunction in an extremity include diminished or absent pedal pulses, capillary refill in toes and GT, 3 seconds, inability to flex or extend the knee, foot, or toes, and numbness or tingling in the foot. Edema should be monitored but is an expected finding during the initial recovery period. A negative Hohmann sign is part of an expected assessment finding if the patient is not experiencing a deep vein thrombosis. The patient's hemoglobin is within the normal range of 13.5 to 17.5 gmdl for males and 12.0 to 15.5 gmdl for females. Question 22. During a code blue, a resident attempts to intubate the patient with an 8 mm endotracheal tube, ETT. As the nurse auscultates the patient's chest afterwards, breath sounds are absent on the left side. What is the most likely cause of this? A. Right bronchus intubation. During intubation, the right mainstem bronchus can be inadvertently entered if the endotracheal tube is inserted too far. Adult endotracheal tube, ETT, sizes are 7.0 to 8.5 mm. While pneumothorax could result in absence of breath sounds, the possibility of tube position should be considered first. Aspiration would not result in absence of breath sounds. Question 23. Following the birth of a healthy baby, the nurse allows bonding time between the infant and its mother. Before mother and infant leave the delivery room, what must be done? A. Mother and infant must have identical ID tags in place. The top priority is to ensure proper identification of the newborn and birth mother. This must be done before they leave the delivery room. Identical numbers are on each of the ID bands and will be checked every time the mother and baby are together. Some hospitals also provide a matching ID band for the father. Question 24. Which of the following is an example of a surgical closed active drain device? C. Jackson-Pratt drain. A closed suction drain is used to actively remove fluids that build up in the body from surgery or infection. There is more than one brand of closed suction drains, but a Jackson-Pratt (JP) drain is common. A JP drain consists of two parts, a thin rubber tube, and a soft, round squeeze bulb. One end of the rubber tube is placed in the area where fluid may build up. The other end comes out through a small incision. The squeeze bulb is attached to this outer end. Open drains are passive and have no suction. The Penrose drain is a typical example. A Penrose drain is a simple latex drain that is freely laid inside the wound or surgical site without sutures to hold it in place. Drainage flows directly onto a gauze dressing. Other passive open drains are a gauzewick drain, a tightly rolled sterile gauze to absorb blood or pus, and a corrugated drain that leads to a gauze pad. Passive or open drains have a higher risk of infection. Question 25. A physician orders 2 units of packed RBCs for a client with a diagnosis of severe anemia. The most important nursing action for administering the blood product is A. To verify the blood product with another iron. Avoiding a transfusion error is the first priority. The nurse should verify all client and blood information with another iron before starting the infusion. An 18-gauge needle is appropriate. A signed consent is required, but placing it in the client's medical record is not the most important nursing action. The ordering provider determines the amount of time for the transfusion. Question 26. When evaluating the arterial blood gases, ABGs, of a patient with a 20-year history of chronic bronchitis, which of the following would the healthcare provider expect? B. Respiratory acidosis, compensated. Chronic bronchitis diminishes airflow during expiration, trapping carbon dioxide, CO2, in the lungs. The increased CO2 lowers the arterial pH, causing respiratory acidosis. The kidneys compensate for the chronic acidosis by conserving bicarbonate. This keeps the pH in a low normal range, resulting in compensated respiratory acidosis. Question 27. A 72-year-old client with uncontrolled type 2 diabetes had a left below the knee amputation, BKA, a week ago. During the first postoperative appointment, the client tells the nurse, "I know my left leg and foot are gone, but I have pain there." What is the nurse's best response? B. It sounds like you have phantom pain, which occurs in the missing part. Phantom pain is the experience of feeling pain in the place where the amputated limb, or finger or toe, was. It is real pain, ranging from mild to severe, and lasting from a few hours to months or longer. Phantom pain can be managed. About 8 out of 10 people experience phantom pain. Usually over the first 6 months after amputation, phantom pain tends to decrease, although 80% of people may experience it 2 years after amputation. Treatment is non-addictive anti-inflammatory medications, injections, and neurostimulation. Question 28. A patient presents to the emergency department with a blood pressure of 180/130 mmHg, headache, and confusion. Which additional finding is consistent with a diagnosis of hypertensive emergency? A. Retinopathy. A hypertensive emergency is a sudden rise in blood pressure, with a reading of 180/120 mmHg or higher. Immediate intervention is necessary. A hypertensive emergency may cause hypertensive retinopathy, resulting in hemorrhages, exudates, or papilledema. Other consequences of a hypertensive emergency include stroke, heart attack, aortic dissection, kidney damage, and pulmonary edema. Question 29. A healthcare provider is caring for a patient with a history of fatigue, dyspnea, and dark stools. The patient states, "My stools are very smelly." The patient's complete blood count, CBC, reveals a hemoglobin of 7 gdl, 70 gl. Based on this patient's history, the healthcare provider anticipates an order to prepare the patient for A. An upper gastrointestinal endoscopy. Melena, dark, smelly stools, refers to the black, tarry feces that are associated with upper gastrointestinal bleeding. The black color results from the iron in hemoglobin being mixed with the chemicals and intestinal bacteria of the digestive tract. Bleeding can be confirmed by endoscopy. Causes of upper GI bleeding include peptic ulcers, gastritis, esophageal varices, cancer, and a Mallory-Weiss tear. Question 30. A healthcare provider auscultates the lungs of an adult patient. Soft, low-pitched breath sounds are heard over the posterior lower lobes. Inspiration is longer than expiration. How would the healthcare provider interpret this assessment data? C. Vesicular breath sounds normally heard in this location. Vesicular breath sounds are low-pitched, rustling sounds heard over the peripheral lung fields, with inspiration being 2 to 3 times longer than expiration. Smaller components of the lungs produce softer sounds than bronchial breathing. Question 31. A patient with chronic hepatitis C is scheduled for a liver biopsy. Before the procedure, the nurse checks the patient's most recent lab results. Which of the following laboratory tests does not assess coagulation? A. Hematocrit. Prothrombin time, partial thromboplastin time, and platelet count are all included in coagulation studies. The hematocrit does not assess coagulation, it reports the percentage of red blood cells, RBCs, in the blood. Question 32. During a routine physical exam, the nurse auscultates the lungs of a client. What type of lung sounds will be auscultated in a healthy client when the nurse listens over the areas indicated by the red excess in this image? A. Bronchovesicular. Bronchovesicular sounds are heard over the major bronchi. In this picture, an anterior view, these sounds are heard around the sternum. Bronchial sounds are harsh, tubular sounds heard over the trachea. Vesicular sounds are soft, low-pitched sounds produced by air moving through the small bronchioles and alveoli. Question 33. The nurse is providing pre-procedural education for a client before a percutaneous transluminal coronary angioplasty, PTCA. Which of the following statements is correct regarding the procedure? C. This procedure compresses plaque in the coronary arteries. Percutaneous transluminal coronary angioplasty, PTCA, is a minimally invasive procedure to open up blocked coronary arteries, allowing blood to circulate unobstructed to the heart muscle. A catheter is inserted into the groin. If a treatable blockage is noted, a guide wire is advanced across the blockage, then a balloon catheter is advanced to the blockage site. The balloon is inflated for a few seconds to compress the blockage against the artery wall. Then the balloon is deflated. Question 34. Following a motorcycle crash, a 44-year-old female sustains a fractured femur. She undergoes surgery for an open reduction, internal fixation, ORIF. After transfer to the orthopedic unit, she becomes increasingly restless and exhibits shortness of breath. What is the nurse's best response? A. Notify the surgeon of the client's change in behavior. The nurse should notify the surgeon stat. One of the major post-ORIF complications is a fat embolism. It is usually associated with trauma of the long bones and pelvis. Signs and symptoms of a fat embolism include shortness of breath, neurologic changes, restlessness, confusion, headache, seizures, petechial rash, and tachycardia. Other possible complications include infection, bleeding, nerve damage, thrombus, malignment of the femur, and irritation from the metal hardware. There is no indication of a low blood glucose, and the other two options are not appropriate at this time. Question 35. Which of these would be most important to include in discharge teaching for a patient with a platelet count of 40,000 mcl, 40 times 10 to the power of 9 divided by L? C. Use a soft toothbrush and floss gently. Platelets, thrombocytes, are important for blood clotting. The normal platelet count range is 150K to 400K mcl, 150 to 400x 10^9L. This patient has thrombocytopenia and should be on bleeding precautions. Using a soft toothbrush and flossing gently can prevent the gum tissue from bleeding. To avoid cuts, this patient should shave with an electric razor. Aspirin can interfere with clotting and should be discontinued. Multivitamins have no effect on platelet production. Question 36. The earliest identifying sign for a developing pressure sore is a localized. B. Change in color. When pressure over a bony prominence is not relieved, the result is ischemia and damage to the underlying tissue. In the earliest stage, stage 1, the skin remains intact but appears red. The area does not blanch when touched. Skin temperature may be warmer. Question 37. The healthcare provider is reviewing the arterial blood gas report for a child with severe, persistent asthma. The blood gas is pH equals 7.28, PaCO2 equals 50 mm of mercury, HCO3 equals 25. Which of these assessments are consistent with this child's arterial blood gas? C. Disorientation, headache, and flushed face. This patient has respiratory acidosis. These are the normal ranges for arterial blood gases: ABG's pH 7.35 to 7.45, PaCO2 35 to 45 mm of mercury, HCO3 22 to 26 MEqL. The increased acid has a depressant effect on the central nervous system, causing disorientation. The increased carbon dioxide also causes vasodilation of the cerebral and peripheral vasculature, causing headache and facial flushing. Other signs of respiratory acidosis include lethargy and shortness of breath. Question 38. The healthcare provider is reviewing the International Normalized Ratio, INR, results of a patient with a history of embolic stroke. Which of the following indicates a therapeutic value for this patient? B. 2.5. Therapeutic INR levels are typically preferred to be slightly higher than normal limits. A general rule of thumb is for INR to be between 2.0 and 3.0 in someone who is receiving anticoagulation therapy. The other values would indicate increased risk of embolism, clot, or bleeding. An INR of 0.5 is within the normal range of 1.1 or lower. An INR of 1.5 is not in the therapeutic range. And an INR of 4.1 would put a patient at risk for hemorrhage. Question 39. The healthcare provider is seeing 4 patients at the neighborhood clinic. Which of these patients should the healthcare provider identify as most at risk for iron deficiency anemia? C. The woman of childbearing age, reporting a craving for ice. Menses may increase the risk of iron deficiency anemia in some women. Pica, the craving to eat unusual substances like ice or dirt, is a classic manifestation of iron deficiency anemia. Gastric bypass surgery may result in decreased intrinsic factor and absorption of vitamin B12. Patients with chronic renal failure require a specific diet plan. A vegan should not develop iron deficiency anemia if the vegan diet is well planned. Question 40. The healthcare provider is reviewing the laboratory reports of a patient admitted to the medical unit for observation. Which of these assessment findings requires immediate intervention? B. Serum magnesium level of 3.5 MEqL, 1.75 millimoles per liter. The magnesium level is elevated. Normal range is 1.5 to 2.5 MEqL. Consequences of elevated magnesium include respiratory depression and heart block. Hypermagnesemia will have the most serious consequences. The BUN level is also elevated. Normal range is 7 to 22 millimoles per liter. The patient will need an evaluation, but this is not as critical as treating the hypermagnesemia. The potassium level is within the normal range of 3.5 to 5.0 MEqL. The INR is within the normal range of 1.1 or lower. Question 41. After a new diagnosis of polycystic kidney disease, PKD, the client seems confused about possible complications and asks the nurse to describe the most serious consequence. Which response by the nurse is correct? A. End-stage renal disease. The most serious complication of PKD is end-stage renal disease, ESRD, which requires dialysis or renal transplant. Polycystic kidney disease can lead to frequent UTIs because of altered kidney anatomy. PKD clients can develop liver cysts with age. Frequent nighttime urination is not related to PKD. Question 42. Following an uncomplicated diagnostic bronchoscopy to perform a biopsy, the client returns to the unit for monitoring. Vital signs are within a normal range and respirations are unlabored. The nurse notes that the client received both topical anesthesia and propofol during the procedure. All of the following actions are appropriate during the immediate monitoring phase except B. Offer the client ice chips or water. Providing ice chips before being certain that the effects of anesthesia have passed can be a risk for aspiration. Topical anesthetic to the throat can interfere with the gag reflex. Although propofol is short-acting, the nurse should be certain that the client is awake and alert enough to be able to swallow. The other actions are all appropriate for the immediate post-procedure phase. Question 43. The healthcare provider prepares to administer a pneumococcal vaccine to a 65-year-old patient who has a diagnosis of chronic bronchitis. The patient states, "I got that vaccine 5 years ago." What is the most appropriate response by the healthcare provider? D. Your last shot was when you were 60, so a repeat vaccination is recommended. To help prevent pneumonia and its complications, a one-time repeat pneumococcal vaccination is recommended for individuals who were less than 65 years old when they received their first vaccination. Some high-risk groups receive an initial pneumonia vaccine of PCV13, pneumococcal conjugate, before age 65. The CDC recommends a second vaccination of PCV23, pneumococcal polysaccharide, at age 65 for these patients. Patients who are 65 and older should receive both vaccines, 1 year apart. Question 44. A client has an order to receive a unit of blood, type A, Rh positive. When the nurse picks up the blood from the blood bank, which blood type would be incompatible? D. Type AB, Rh positive. It is always ideal to administer the same blood type and Rh factor. However, if the Rh factor is compatible, type O, the universal donor, can be administered. For this client, type A, Rh negative, and both type O options are acceptable. Type AB will cause a blood reaction and must not be administered. Question 45. A child with a peanut allergy has recently been diagnosed with asthma. The healthcare provider instructs the parents on ways to prevent the child from coming in contact with peanuts. This instruction is necessary because the child is at increased risk for which of these problems? D. Anaphylaxis and respiratory failure. A child who has asthma is at the greatest risk for death secondary to anaphylaxis, a severe type 1 hypersensitivity reaction caused by a food allergy. Type 1 hypersensitivity reactions can cause a variety of signs and symptoms, depending on the severity of the hypersensitivity response. Question 46. When a healthcare provider is caring for a patient with a cardiac dysrhythmia, it is most important for the healthcare provider to monitor the patients. D. Sodium, potassium, and calcium. Because abnormalities in sodium, potassium, and calcium levels are likely to affect depolarization and repolarization of cardiac cells, it is most important for the healthcare provider to monitor these laboratory values. BUN and creatinine levels are always important to monitor when administering any drug, not only antidysrhythmia drugs. The PT and INR are important for patients who are on warfarin, Coumadin. Question 47. Which cardiac arrhythmia is present on this 12-lead EGG? D. Atrial fibrillation. Atrial fibrillation is the most common chronic arrhythmia. Atrial rates can be 400 to 600 bpm. P waves are absent on the surface ECG. Frequently, fibrillatory waves are noted, representing erratic atrial activity. Atrial flutter has a sawtooth pattern, compared to the fibrillatory waves of atrial fibrillation. Sinus tachycardia is a regular rhythm and GT, 100 bpm. Second-degree heart block is a disruption of atrial impulse conduction to the ventricles through the atrioventricular node, AVN. ECG credit, Creative Commons Med.Doc 13. Question 48. A client is admitted to the inpatient mental health unit with a diagnosis of suicide risk. The nurse knows that extra precautions need to be taken. D. At shift change. Shift change requires extra precautions because fewer staff are available for monitoring patients. Night shift and weekends also present some risk, but weekdays do not. Question 49. A child with a history of asthma is admitted to the pediatric unit for a minor surgical procedure. The nurse is monitoring the child's oxygen level by continuous pulse oximetry, SpO2. Which SpO2 reading is the best indication of proper oxygenation in a pediatric client? D and GT, 95% SpO2. Normal oxygen saturation levels, SpO2, are between and NBSB, 95-100% for both adults and children. And NBSB, pulse oximetry provides a fairly accurate measurement of oxygen saturation. However, the nurse should also observe the client for signs of hypoxia, increased pulse and respiratory rate, changes in color cyanosis, and use of accessory muscles. Levels below 95% are abnormal. The brain is affected at 85% and lower. Question 50. The nurse working on a cardiac unit receives a prescription for a 20 mEq potassium chloride, KCl, for piggyback. Which ECG finding on the client's monitor will cause the nurse to notify the healthcare provider, HCP, before administering the KCl? D. Peaked T waves. Tall, peaked T waves with a narrow base are early indications of hyperkalemia, so administering more potassium is not recommended. The normal serum potassium range is 3.5 to 5.0 millimoles per liter. Hyperkalemia occurs when the serum level exceeds 5.5 millimoles per liter. A level about 6.5 millimoles per liter requires immediate medical intervention. Prominent U waves are characteristic of hypokalemia. A short PR interval is seen when the AV node delay is bypassed, as in Wolff-Parkinson-White syndrome. A narrow QRS complex is consistent with sinus tachycardia.